I'm going to talk a little bit about decision-making between anatomic and reverse and lessons learned. And a little bit of historical perspective, at Mayo we have the longest joint registry in the world. And when you look at the data, I think it highlights some of the reasons that a number of us have switched to reverse on a number of these cases. So this was a study, 6 different glenoid designs at the Mayo Clinic, 20 years, large number of shoulders. You can see a variety of different components were looked at. And when you look at risk factors for failure and things that I think about when deciding between anatomic and reverse, you can see that the risk factors, at least at our institution, are male gender, post-traumatic arthritis, and avascular necrosis. And this is the challenge. When you look at a glenoid component, particularly an all-polyglenoid component, what ends up happening, the components look good at 5 years and then it falls off a cliff. So this is the radiographic failure at 10 years. You can see there it's quite substantial. So when we think about this over time, different glenoid component designs have evolved over time, thinking about how can we get longer-term fixation on these, particularly when we think about trying to do anatomics in younger patients. There have been different designs, different hybrid glenoid designs. I know Tom Wright and the Exactech group have published extensively on this. At Mayo, we have an experience with this as well, thinking about this, because we know the challenge with an all-polyglenoid is that bone will never heal to cement or polyethylene. So the thought is the opportunity for longer-term fixation with porous ingrowth metal. So this was a study that was done, combined Mayo Clinic and Campbell Clinic, looking at 713 shoulders. And what came out of that was a low rate of failure, and the mindset now is, this is the algorithm that I use typically thinking about how do I decide between anatomic and reverse. 0 to 10 degrees, good evidence for high side ream, 11 to 24 augmented anatomic, and more than 25 degrees reverse.